Our approach to treating a patient is with an assumption that nobody wants to come to the dentist. That dentistry is either creates fear, creates guilt, creates embarrassment. And so our approach to that usually is, let's just get that right out in the open. Let's talk about that. Let's ask questions. Many times I think the guilt and embarrassment that people feel is a result of us as a profession. We just haven't treated people, well, one, we haven't treated them maybe the way we should have in the past, and two, some of the things that we thought were the patient's fault, now we're finding out wasn't their fault at all. It had something to do with their heredity or their genetics. But they were always thought to believe that it was up to me to fix myself, and if I can't, there's something wrong with me.
My favorite story is Shannan, and I talk about her all the time. She was somebody that hated dentistry, absolutely hated dentistry.
I'm terrified of I'm terrified of, like, by terrified, I mean cold sweat breaking down and running down my face. It started way back when I was a little girl. I mean, I had a dentist pull a tooth, an impacted tooth. I was 10. And he said that I was being a baby, but he hadn't given me enough Novocaine. And the next thing what I remember is kicking him and running out, and blood was running down my face, and my mother was horrified. And she's like, and then we found another dentist who was a really nice man. He passed away. So going to the dentist was like, every time I went to the dentist, it was like pain and fear.
Shannan was so fearful of dentistry, she bordered on belligerent, I would say, in that she was just so defensive. Don't touch me there, don't touch me there. What are you doing now? What do you do? Why do we have to do this? And so that's the way I met her that way.
I had a toothache that I couldn't get rid of. Usually, you know, you just stuff a little Ambisol up there and call it a day. No. I had a infection up under my root. I think that's what started it. And then Dr. Pierce and his staff were so good, they said, you really need to come back and see us.
I think Shannan came in feeling that there was no hope, that it didn't really matter who she went to, it wasn't going to work out. She was almost doing her due diligence, but she was going to be a dental cripple her whole life. And as we talked and she saw other work that we had done, she had seen some testimonials that other people had done, I think there at some point there became a spark of hope that, you know, maybe I could become one of those testimonials someday. Maybe I could have a mouth like that. Maybe it could work out for me. And prior to that, she didn't have that.
She came in here and she would need to be sedated just to get into the consult room. And I was in on some of the initial consults. She would just cry. I mean, she was in such a dental situation that she could lose all her teeth at a very young age. And so she didn't trust dentistry. She didn't want anybody to know that she was going through this. And so just Dr. Pierce taking her through that process and understanding and taking our time with her and really coming up with a plan for Shannan that was absolutely going to work.
He makes a lot of sense to me. He's very logical. He's just like, no bones about it. This is what you need. This is what we're going to do. This is how we're going to accomplish it. And this is the time we're going to do it in. And he was true to his word. And he put up with a lot from me. I didn't jump out of the chair, but I was always, look, what are you doing back there? I was always wanting to know what he was doing behind me. And another strategy we have is I only have one dental hygienist. That way I'm comfortable with her, and she knows how I am. She's really good with me.
We all feel wonderful when she comes in the room and into the office, and we know how great she feels about herself. And, you know, strategy to get her in here, and we know what it is, and we know what to do and what not to do, and she comes in and we do it, and she's happy when she leaves.
I'm not afraid to come here, but something in the back of my head, there is always, but when I come here, it's like coming back to a new family. It's like Tina, I walk in, Tina's like, hey Shannan, there's my favorite patient. I'm like, hey Tina, you know, we chit chat about our kids, and I mean, I really like these guys. I recommend them to everybody. I don't know if anybody comes that I recommend, but I tell everybody to come here.
She has come out of dentistry on the other end. She comes to all her regular preventative visits. She's always here. And she will talk about what an easy process this was, what a wonderful, how we've taken her from this place of despair and just thinking that I'm going to lose all my teeth and what am I going to do with my life if people find out about this, to look at this beautiful smile I have.
I smile more. I laugh more. I take more pictures, you know, like family pictures, you know. I don't sit in the corner. Like, I talk to people, but when you have really bad teeth, you try to cover them and hide them. You become a master and an expert at it. I don't have to do that anymore. You know, I mean, it's, I literally have the perfect smile. The perfect smile for me, and that was what the end goal was, and I'm happy about it. It's been quite a journey, and I'm thrilled that I did it. I mean, believe me, I really thought long and hard about doing it, really long. But it was the right thing.
Now that Shannan is through, she has confided in us, she trusts us implicitly, and then she has confided in verbally, testimonies, video testimonies on our website. If you talk to any time.
Now, this is somebody that didn't want anybody to know that she struggled with dentistry, and she'll sit out there and tell everybody what a great practice this is.
I contributed to him knowing the right way to approach me and say, instead of, he didn't come at me head on, he came at me kind of from the side. And that is exactly what I needed. He was everything that I needed.
The key ingredient to us helping out was just plain being empathetic to her past, and being patient with her, and just plain old-fashioned TLC.
I drive a car in my mouth. My mouth is worth a car. I've had full reconstruction. I have implants. I have, you name it, I've got it. Well, no, I don't have it anymore, but I have a $10,000 smile. And it was worth every penny of it. I cannot place a value on anything that's been done to my dental work. I can't. It really has changed my life.